You ever wonder what really makes a hospital tick? It's not just about the doctors and nurses on the front lines. Behind every single decision, from where to build a new wing to how to fight an infection, there's this huge invisible world of data. And today, we're going to dive right into that world and decode the numbers that literally save lives.
So how in the world does a massive, complex place like a hospital even know if it's doing a good job? Is it just a gut feeling? No way. The answer, as you can probably guess, is all in the data they're collecting, day in and day out.
And this really gets to the core of it. We're talking about statistics that are the command center for the entire operation. They're not just for some dusty old report. Hospital administrators use these numbers for the big stuff, planning out the building, making sure the lights stay on financially, and, most important of all, constantly figuring out how to get better results for patients.
All right, so here's the plan for today. First, we'll talk about why all this counting even matters. Then, we'll learn the basic lingo, the language of health data. After that, we're going to check a hospital's vital signs. And finally, we'll zoom out and look at the health report for an entire nation. Sound good? Let's jump in.
Okay, first up, the language of health data. The best way to think about this is like learning basic grammar. Before you can read a book, you got to know what the words mean, right? Same thing here. We need to get a handle on the different types of data before we can understand the stories they tell us. So, what's really cool is that pretty much all health data fits into one of these four buckets. First, you've got nominal data. That's just names or categories like gender or race. Simple. Then there's ordinal, where the order matters, like the stages of a pressure ulcer. Stage 2 is definitely worse than stage 1. Then we have interval data, like temperature. The difference between 98 and 99 degrees is the same as 99 and 100, but 0 degrees doesn't mean no temperature. And finally, you have ratio data. This is the good stuff with the true zero. Think about age, or how long someone stays in the hospital. This stuff is critical because it decides what kind of math you can even do with the numbers.
And we can simplify even more. You can basically group all that into two main types. On one side, you have discrete data. This is stuff you count. It falls into neat, separate categories. On the other side, continuous data. This is stuff you measure, things like height or weight, where you can have fractions. At the end of the day, just remember, count versus measure.
All right, now that we've got the language down, let's actually check the pulse of a hospital. Just like a doctor checks a patient's vital signs, administrators use key numbers to check the health of their entire hospital. This is where it gets really interesting.
And one of the most fundamental vital signs is the inpatient bed occupancy rate. It's pretty much exactly what it sounds like. What percentage of your beds are full? It seems simple, but this one number tells you so much about efficiency, planning, and whether you have the resources you need.
So you'd think the absolute max is 100%, right? A full house. But what if I told you a hospital's occupancy rate can actually be more than 100%?
I know, that totally sounds like it breaks the laws of physics, doesn't it? How can you possibly have more patients than you have beds? Well, let's unpack how that little statistical quirk can happen.
It all boils down to one word: turnover. Imagine a patient goes home in the morning. By the afternoon, that same bed is cleaned, prepped, and a new patient is admitted. In a single day, that one bed served 2 different people. Now, if that's happening all over the hospital, the total number of patients served can actually be higher than the number of beds. It's a sign that a place is incredibly busy.
Okay, here's another huge one: the average length of stay, or ALOS. This is all about how long, on average, a patient is in the hospital. Generally, a shorter stay means care is more efficient, it frees up beds faster, and it has massive implications for the hospital's bottom line. And the best part? The math is refreshingly easy. You just add up the total days every discharged patient stayed, and you divide that by the number of people who went home. That's it. So simple, but so powerful for figuring out how well a hospital is performing. And of course, there's a whole dashboard of these vital signs. You've got the bed turnover rate, which we just touched on. They look at death rates, obviously, and they are absolutely obsessed with the hospital-acquired infection rate. That's when patients get sick at the hospital. They even track something called the case mix index, which is just a fancy way of measuring how complex or sick the average patient is. Every number tells a piece of the story.
Okay, time to zoom out. We've seen how one hospital keeps an eye on its own health. But how do we do that for an entire country? Well, that brings us to our last section, a nation's health report. In the U.S., this giant task falls to the National Vital Statistics System. Think of them as the official scorekeepers for the country's health. They track all the big life events, births, deaths, marriages, you name it.
And the whole point is to spot trends so we can, you guessed it, improve the health of the whole population.
Now, when you're talking about disease on a national scale, you'll hear two words all the time: incidence and prevalence. The incidence rate is all about the spread. It tracks the number of new cases. It's the speed of the problem. The prevalence rate, on the other hand, is a snapshot in time. It's the total number of people who have the disease right now. That tells you about the overall burden.
And when you put those two ideas together, you get what's called morbidity. It's the scientific term for how much disease or illness is out there in a population. So when you hear health officials talking about morbidity, they're really just using incidence and prevalence to measure how sick a community is.
And the flip side of morbidity, as you can imagine, is mortality. This is the measure of deaths. You can look at it really broadly with something called the crude death rate, or you can get super specific and look at a cause-specific death rate, like deaths from heart disease alone.
You know, the level of detail they collect is just unbelievable, because precision means everything. For the data to be useful, even the most sensitive events, like fetal deaths, have to be carefully and consistently classified, in this case, by gestational age. It's this kind of precision that lets researchers find patterns and, hopefully, find ways to prevent tragedies.
So after all of these formulas, all these definitions, it all comes back to this one simple idea. It doesn't matter if you're a hospital manager looking at bed turnover or a scientist at the CDC looking at mortality rates. The goal is always the same. Use the data to help people live longer, healthier lives. The numbers are in service to the people.
All right, let's do a quick recap. The big takeaways here are: first, statistics are absolutely the lifeblood of any modern hospital, for planning, for revenue, for everything. Second, all health data speaks a kind of language based on those 4 scales. Third, hospitals track their own vital signs like occupancy rates to stay healthy. And finally, those big population stats, morbidity and mortality, are what guide our entire public health system. And that brings us to a final thought I want to leave you with. If you can only look at one single statistic, one number, to judge the overall health of an entire country, what would it be? Life expectancy, infant mortality, something totally different? It's a really tough question, but thinking about it gets to the very heart of what we value most when we talk about a healthy society. Thanks for joining me on this one.